Hi, welcome to my channel. If you're new here, welcome. If you're returning, welcome back, guys. So today I'd like to give a shout out to Musenge. Thank you for suggesting I do this video. Today I'm going to be talking about post-myomectomy or fibroid removal surgery recovery. So I'm going to be giving you 12 tips that I used that helped in my recovery process. So the first tip is going to be to walk as soon as possible. As soon as you get the okay from your doctor, get out from your bed and try and take a few steps around your hospital room. Of course, the first time you try to get out of bed, you're going to feel a little dizzy, a little wobbly on your feet, but there will probably be a nurse there to help you or a family member. So allow them to help you to walk around a little bit. Walking promotes the flow of oxygen throughout your body, and this then enables you to have normal breathing function. It also helps with blood circulation, which is essential in the healing process. I remember when I had my myomectomy, my mom helped me out of bed to try and walk. There's a feeling of your gut might spill out of your body anytime, so there's that little thing at the back of your mind that makes you a bit scared to do it, but the doctors sewed you back up in such a way that your gut will probably not fall out when you walk. Don't be too scared. I know it's scary, but take the plunge, take a few steps, walk a little bit. My second tip is to not lift any heavy things. Now, if you're like me, I don't enjoy sitting around and doing nothing. I like to be helpful. So it was very difficult for me to just sit and not do anything, especially because I had a small child at home. He was 3 months old when I had my myomectomy. So each time he cried, I would feel this urge to pick him up, but I'd have to resist it because I knew that putting a strain on my incision area might make it bleed, and that's the last thing that you need after you've had surgery, to bleed out and have to have more interventions to mitigate that problem. Also makes you susceptible to infections. So just try your best not to lift anything heavy during the first few weeks. My third tip is to rest when you feel tired. Rest is absolutely critical because you heal when your body is resting. When you sleep, your body is healing. And the reason you feel exhausted after surgery is because of the anesthesia medicine that they give you during surgery. So that does tend to give the patient fatigue. So just know that feeling tired or exhausted after surgery is normal. So it takes a while for the body to get rid of all those medicines that were put in you. And also during surgery we lose blood, so you might be slightly anemic afterward, and anemia does tend to make you feel fatigued. So when you feel tired, make sure you rest. This was very difficult for me, the resting. I'm someone who likes to always be doing something. So just acknowledging that my body is tired and I need to rest was not so easy, but it's something that I had to do if my body was to heal in the quickest possible time. My fourth tip is to take showers rather than baths. So when you've had an open myomectomy, you obviously have an incision, and it's crucial that you try and keep that incision as dry as possible. So rather than taking a bath, which requires you to submerge your body in water, rather take a shower so that there's as little contact with water as possible. So if you don't have a shower at home, you only have a bathtub, what I found to work for me is I'd fill a bucket up with water. Well, obviously not me personally, it would be too heavy, but I'd ask someone to help me fill up a bucket with water, and then I'd get into the bathtub, lather myself with soap, of course excluding the area with the incision, lather myself with soap, and then when I was ready to rinse it off, I would get down to the kneeling position, and with a scoop I'd pour water over my body to get rid of the soap and immediately pat dry the incision area. So that's something you could try if you don't have a shower at home. My fifth tip is to drink lots and lots of water, as well as to eat foods rich in fiber. This is because drinking water and eating foods rich in fiber encourages your bowel movements. The last thing that you want is to be constipated after you've just had major abdominal surgery. So drink that water, eat those high fiber foods, eat those fruits and vegetables in order to avoid constipation. My sixth tip is to take your medicine as instructed by your doctor. Take your medicine exactly when your doctor tells you to take it. Don't skip days or forget. Try as much as possible to remember. The last thing that you want is to be uncomfortable while you're trying to recover, to be in pain. That's not the ideal thing. So make sure you adhere to your doctor's instructions with regards to taking your medication. My seventh tip is to make sure you have pads nearby. There is some bleeding after an open myomectomy, so you want to make sure that you're always wearing a pad during the first few days so that you don't have any issues. My eighth tip is to try and mobilize as much support as you can. During the first few weeks after a myomectomy, you essentially can't do very much. You basically just sit around all day, eat when possible, do a bit of exercise every day, but you can't really do anything else. You can't do laundry, you can't cook, you can't do anything. You just have to rest. So try and make sure that you have a support system in place that will enable you to get as much rest as you need. So in my case, post my surgery, I was at my parents' house, so I had my mom and dad to help me, as well as my sister. That was critical because there's so many things that I couldn't do for myself. Even something as simple as cleaning my incision, I couldn't do that because my belly was so big it would overlap over the incision. So in order to clean it, I'd have to hold up my belly, and then my mom or my sister would clean the area up. And then when my son cried, of course I had the urge to go and pick him up, but I knew that I couldn't, so my dad would always bring my son to me, and then I could feed him and take care of him in that way. And of course I didn't have to worry about cooking or cleaning or any of that. So get as much support as you can. My ninth tip is to keep the incision area clean and dry. Of course, I'm not suggesting that you substitute my advice for a doctor's advice. I am merely stating what worked for me. That might not work for you, but after I had my C-section, I was instructed to clean the incision site with methylated spirit, but I found that my body wasn't responding very well to that. After my wound was cleaned with spirit in the morning, in the evening it would still be a little bit moist, and it wasn't drying as well as I would have preferred. So we started using medicated soap and saline solution to clean the area. So my mom would get sterilized cotton balls or gauze, and she'd put them in saline solution, you know, the kind that comes in the drip bag. So she'd put some of that in a sterilized dish, and then put the gauze, the sterilized gauze or cotton wool into the saline solution, put some medicated soap on it, and clean the area, and then rinse it off with the saline solution. The soap I used was Lifebuoy medicated soap. You don't really find it that often these days. It's like, you know, the old-fashioned one, the really red one with the funky smell, that one. That's the one that I used, and I found that my healing was much better. So after my myomectomy, I just used that and I had no problems at all. The healing was perfect, the wound stayed dry. Tip number 10 is a pillow. A pillow will become your new best friend. The first few days after surgery, you don't want to laugh, you don't want to cough, you don't want to sneeze, you don't want to do anything that might require you to use your ab muscles and potentially put a strain on the incision. So a pillow is useful in those occasions when you have no choice, you have to laugh. Something is so funny, you have to laugh, or you need to sneeze. So when you have to do any of that, you just take your pillow and gently apply pressure onto the incision site to sort of give extra support, so that you don't have the feeling of your guts about to split open. So that's a major thing. Pillow is your best friend. Put pressure onto the incision site, and then you can sneeze and cough and laugh. But generally, just avoid any of these things if you can, especially the laughing. I remember being so annoyed with my sister because she had the nerve, the audacity to put on a funny movie a few days after my myomectomy, and it was so funny, and I wanted to laugh, but I ended up crying because I knew that laughing would hurt. So just avoid any of that sort of stuff if you can. Obviously, if you have to sneeze, you don't have much of a choice, but things that you can avoid them by all means. My 11th tip is to use an abdominal binder. I found this especially useful after I had my myomectomy because my stomach was so big that it would tend to overlap onto the incision. So in the first few weeks, I used the binder to sort of keep my big belly off of my incision site. So I put the binder above the incision site in order to avoid my belly rubbing onto my incision. And then after a few weeks, after the external wound had healed, I used it below the incision just to give that extra support, because I know on the outside your wound may heal, but on the inside your skin, your tissue, everything is still healing up, so you still need that extra support. So it really helped me just in terms of giving me a little bit more confidence to do a few more things. So it's a little bit worse for wear. My 12th tip is to be kind to yourself. I know after you have surgery and you look at your tummy and it's still all swollen and sore, it can feel a little bit depressing, and then there's also the prospect of the scar. It's not the nicest feeling, but be kind to yourself. Your body has just gone through a major surgery. It's going to take some time for the swelling to go down. It could take weeks, even months, for your stomach to ever look any sort of normal. But at the end of the day, I think your quality of life will be so improved by the surgery. Your quality of life will be so much better, and I think that outweighs the superficial element of the scarring. If you have any questions regarding fibroids, myomectomy surgery, or anything that you think I might be able to give you some insight on, please don't hesitate to leave a comment below. Or if you prefer not to be quite so public, you can follow me on my other social media and send me direct messages from there. I hope you enjoyed this video. I hope you found it helpful. If you enjoyed it, don't forget to like it. And if you'd like to see more of my content and you think I'm doing something that you enjoy watching, make sure you subscribe to my channel and hit the notification bell so you get notified each time I post a new video. And also don't forget to share if you've enjoyed it. Bye!